Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Have you ever been unsatisfied with your patient's test results for Lyme or other tick-borne infections? Armin Labs can provide you with the latest and most sensitive test methods for bacterial and viral infections. Their worldwide services are available to therapists and patients. For more information, visit them online at arminlabs.com. Thank you for joining us today, and our guest is Dr. Armin Schwarzbach. Thank you for joining us, Armin.
Hello, everybody. Here's Armin from Germany.
Thank you. Our listeners always like to know who the guest is. Could you tell us your background? What made you become a doctor and a PhD? What led you to that route?
My life story is a little complex. After finishing school, I didn't know what to do, and I studied biochemistry and pharmacy, but what was missing was the aspect to human beings. So I decided to get a medical doctor, and I did a study for 6 years, getting medical doctor, and I worked in internal medicine, oncology, gastroenterology, cardiology, also with infections that time. Chronic Lyme didn't exist in the early 90s for me. And after that, I thought about getting another qualification because the aspects of diagnostics are so important for me, and I studied also 6 years getting laboratory specialist, and I have specialized also in endocrinology. I developed testing, so I reached also my PhD, and nevertheless I'm an all-rounder, and I always want to know what's the reason behind illness, and so my whole life is to help patients to improve, to get better, and I really want to help the people. The money issue is not the main point for my work. I really want to improve something in the world, and I think the chronic infections are completely underrepresented. Lyme disease is underrepresented. Also virus infections in chronic forms, they don't exist in medicine. We have now a change in the whole world for that, and so my aim is now really by my heart to help patients with chronic Lyme disease, co-infections, and multiple infections.
Mm-hmm. So if a patient has had blood tests in the past and they've come back negative, as you know many of them do, what is the correct way of finding people like yourself, or indeed yourself? You said in the advert there that you help people worldwide. How do people contact you, Armin? Do they go online? How do they get the blood to you? Yeah,
it started for me 15 years ago. I had a patient with multiple sclerosis, and the antibody testing was negative by Borrelia ELISA, and then I did the first time in my life the Borrelia ELISpot, looking at the T-cellular immune reaction against Borrelia, and that was positive. And this multiple sclerosis patient was diagnosed with chronic neuroborreliosis afterwards, and patient got therapies, and patient got healed from multiple sclerosis. And this was, for me, really an event in my life. I have never thought about multiple sclerosis in correlation with Lyme disease. So, and by that, I worked for a big group, the SynLab group in Europe. It's one of the biggest laboratories like Quest or LabCorp in USA. And by that, I decided for myself there's something going wrong in medicine. I have to do something. I got somehow a mission. I cannot tell you that point. But I said, Armin, you have to do something. You have to change something. And then I learned the hard way that I'm a minority, and all the neurologists, they told me chronic neuroborreliosis doesn't exist, or it's multiple sclerosis. And by these effects, you have a lot of opponents. But on the other hand, I helped a lot of multiple sclerosis or other patients with Alzheimer's, Parkinsonism, fibromyalgia. Chronic fatigue syndrome is really a big issue in chronic infection, like with Borrelia and Chlamydia, etc. So I have fulfilled my own satisfaction now, and this is very important. The mouth-to-mouth, we name it. So one patient is telling the other, "Oh, you know that doctor? I had now a Formula One racer from Europe, and he got the information in a plane, sitting beneath another patient of mine, and this patient improved, and they had similar stories. This Formula driver came to me, and he improved within 2 weeks, and this gives me satisfaction. And if you get a satisfaction as a doctor, you can help, you can do something, not just to use painkillers or not just to use immune suppression, corticosteroids, all this bad stuff making you sick. A lot of these drugs are making you sicker and a lot of side effects. So I have to fulfill my mission, and my mission is to fight for the acceptance of chronic Lyme disease and chronic infections.
Mm-hmm. I mean, treating the cause rather than treating the symptom has to be the way to go, doesn't it?
Yes, what I've learned, also my generation at university, I studied in the 80s, middle till late 80s, and I had learned about that we have to treat symptomatic. So a patient came with pain, and I used painkillers, the same. A patient was coming with concentration problems, so I gave something for better perfusion of the brain. So it was a patient coming with also other pain, fibromyalgia, rheumatoid arthritis. I gave corticosteroids. So I adapted to the general way of the majority of doctors and the so-called guidelines. But nowadays I know it a little better that you can find a reason behind that, and you can do something for that patient. I worked in oncology with a lot of chemotherapies, and a lot of my patients died that time. And now I have this satisfaction that if you suffer from a chronic infection and you have multiple sclerosis-like symptoms, I name it, it's not a multiple sclerosis, so you treat the infection and the patient gets better. And this is what is the aim, the mission in my life. And this should be the mission also of other doctors. If you have to help a patient and not to say do symptomatic therapy.
Mm-hmm. And how easy is it for patients to have their testing with you?
It's very easy. We have special contracts with FedEx and also DHL, Medical Express, or UPS. We get samples from all over the world, from Australia, from Canada, from Alaska, from Southern Africa, whole Europe included. So patients can send this special testings for the ELISpot, which is a time-critical testing, within 3 or 4 days maximum into my laboratory. And then you get the results within also 3-4 days later, because doctors need to do a decision with the patient. You cannot say, now I wait 1 month for result. That's impossible, because patients are suffering, and you have to do something.
Mm-hmm. And how do you take the blood? Is it a pinprick on the finger, or do they have to see their doctor to have a blood taken?
When I diagnosed 15 years ago that patient in Germany from Hamburg, far away where I worked in Munich, I thought about exactly that question: how to bring this time-critical blood tubes into my lab or into our laboratory. So I developed a special test kit with special cell-stabilizing tubes, CPT tubes, it's named. So it's an additive in it, and so it stabilizes the cells for the special analytics for 3-4 days. And so it's possible to send a special test kit from Armin Labs to the patient, to the therapist, and then to send it back. That's now there's no problem.
But how does it work? How do you get the blood in the tube? Can the patient do it themselves?
No, patient cannot take the blood. You need a nurse or you need a doctor or a naturopath, but everybody who takes blood can take the patient's blood.
Okay. And once you have received the blood and you've tested it and sent it out to the patient, the diagnosis that you have from the laboratory, that is sent to the patient to hand to their doctor, or do you deal with it? Do you give advice at the same time?
It depends. I have this way or the other way. I help some patients in explaining in correlation with their symptoms the laboratory test results. On the other hand, I have also a therapist, and I help therapists also in explaining results. What does it mean? But don't forget, we don't treat laboratory test results. We treat always the symptoms. So we have to correlate and to educate therapists, doctors, look at the symptoms, we name it, look at the anamnesis, look at the history of the anamnesis, and look at the differential diagnosis. And then you have to decide, is it really chronic Lyme disease, or is it maybe a Yersinia infection or a virus infection with EBV, CMV, or is it chlamydia, mycoplasma, or is it all together? And the last years, my development was to find out that every patient I've seen with Lyme disease has another infection or more infections. We name it chronic multiple infections. So there's not one patient with just Lyme disease. They all have different infections, and then you have to diagnose it in the correct way and then to treat it. If you would treat it in the wrong way, then you can damage the patient. So you need the laboratory test to find out which infection is active and which not, and therefore I do this ELISpot.
Mm-hmm. And how open-minded are doctors now, Armin? I know you said years ago they weren't very open, they were just treating the symptoms. Have things improved over the years?
You know, laboratory is a big market. Let me say it's a business. For neurologists, rheumatologists, for herbalists, for naturopaths, for also some other points of antibiotics, for virus statics. So it's a market. And that means if you come into market, you come into lobbyistic structures, like in every business in the world. So now we have the lobbyistic structures. I don't want to name the pharmacies. Also, they have a big lobbyistic structure, not just in Germany. But if you come into that and say, hey, I have a solution, I can cure your patient, the patient doesn't need any longer the painkillers or the corticosteroids, then, what's going on then? Then you have a shift of the therapy options for patients. And what I have learned my whole time, also in cancer, I want to know what's the reason for it. And if I know the reason, I can treat it. I don't want to say I find the reason for every patient with fibromyalgia, but if a patient has an infection, then you have to treat the infection, and then the patient doesn't need the painkillers.
Mm-hmm. And how easy is it to find an open-minded therapist? Are you able to assist people to find somebody in their area?
It's really a critical point because my generation, I was born in the early 60s, we are not educated in these infections. Lyme disease came up in 1981, and this was the time when the HIV infection came up. So, I have an internal network of therapists in the world, and more are coming into it because they say, now I can do something which I didn't do before. And believe me also, some of the therapists are sick or some family members. And if you have these illnesses with a chronic infection, with Lyme, with Bartonella, with Babesia, with Rickettsia, then you see it from a different other point. And then you say, I take the patient honest now. I'm a patient myself. I treat it myself. So this is also a snowball principle. Let me name it in this way. But we are minority. We are not the majority.
Mm-hmm. But do you think people are becoming more open-minded? Would you say?
Yes, we have now the internet, and we have a lot of discussion forums, and so we have the Facebook. We didn't have that in the 90s, and so the patient is sometimes better informed than the doctor. and that makes it really complicated for a doctor if a patient knows more. It's not just the field of Lyme disease, also other fields. That makes it really complicated for a doctor to help a patient, and the patients, they are really frustrated, and the patients, they are going their own ways.
Okay, so if we have patients with chronic fatigue syndrome, MS, fibromyalgia, you said Parkinson's as well, anybody that has a chronic illness, do they need to have their blood tested? What would you say?
Yes, absolutely. If you have the suspicion for such an illness by the symptoms, I have developed a so-called co-infection checklist for it. You can go on our homepage, you can see it, you can fill it out, very easy, by your symptoms and by the differentials of different chronic infections. And then you do the testing for it, selection of testing, so you must not spend thousands of dollars. That doesn't make sense, you know. You do a test selection, and I help this, or my lab team is helpful, and then we do the special test. And we are the first laboratory in the world, Armin Labs. We can offer now Bartonella ELISpot, that's a sensation, Babesia ELISpot, that's sensation, Mycoplasma ELISpot, that's sensation, and also varicella zoster virus ELISpot. We look at the T cells, we look at the cellular immune system. We don't look at that old-fashioned IgM, for example. The IgM is not interesting for me. We look at chronic infections. I want to know what's the ELISpot telling you for Borrelia miyamotoi, for Borrelia burgdorferi, for chlamydia, for Mycoplasma now. And then you find out each patient is different from the other, and then you can do a good decision for therapies. Coxsackieviruses is such a huge, it's enterovirus. It starts with diarrhea in the families. The whole families got sick. They have concentration problems, memory fog, chronic fatigue syndrome. They have joint arthritis. The whole family. It starts with diarrhea in the family, but no doctor is asking for diarrhea in the family. So this was a starting point. Whole family is sick. Similar symptoms, sitting in the office. And then you have to find out, do I find IgA for Coxsackie or not? IgA is the important marker, not the IgM. Yersinia, exactly the same. You eat chicken, you eat eggs, you eat mayonnaise, you eat ice cream. Everywhere can be Yersinia. So Yersinia makes arthritis. And this is what I mean. You have, for each patient, you have to do individual diagnostic testings, and therefore you use the co-infection checklist.
So once you've had the blood test, does it have to be repeated after a period of time?
Yes, if you react on a ELISpot testing on IgA, it's a natural immune defense. Don't misinterpret. It's good that you react on it, but it's pathologic. It's not normal. So after end of therapies, that has to normalize being negative, getting negative. So ELISpot has to get negative 4 to 6 weeks after stopping therapies. This ELISpot for Epstein-Barr virus has to be negative. If it's not getting negative, there's something wrong in the system. Please control the patient. And this is what really is done, a bad mistake in the world. The patient are not monitored. If you have infection with a bullseye rash, nobody's controlling you. Everybody says, oh, 1 week doxycycline is fine. And then you produce the chronic patients. And this is why the offices are full of these Lyme specialists in the world.
Mm-hmm. So if you do have chronic Lyme, and I know I've spoken to many people that have, who think that they will never get better, are they able, with having the correct testing, the correct therapist helping them, can it be cured or can it be managed? How does it actually happen, Armin?
I want to say from a different point of view, is it really Lyme disease you're suffering after a while, or is it a virus infection? And I'm so convinced that the viruses are the problem. After a while, your immune system is getting so suppressed by Borrelia, the viruses come on, herpes of the lips, lymph nodes swollen, sore throat. Then you have an Epstein-Barr virus problem. And then the therapy is completely different. You have to support the immune system, not to use antibiotics. Antibiotics are destroying the immune system. Don't use antibiotics in virus infections. It's not allowed. Improve the immune system. And then also, additionally, you have some herbal or complementary option. And this is where LDN comes into that complexity of whole body therapy concepts. That plays really important role in this fibromyalgia, rheumatoid arthritis patients. I'm so convinced, and I know so many therapists using it. Today I got a message from Dan Cameron on Facebook that he's using successfully the LDN. It's not curing. I don't want to do promotion for LDN, but what I heard, I'm doing services for laboratory. I am laboratory doctor doing services, and what I hear from so many therapists, this is what I get into my brain. I get an impression if it's helpful. It's a therapy option for sure. Maybe some patients are cured, maybe some not. But additionally, think about LDN also.
And what other therapies would you say are used to help the immune system?
Yes, so what I'm convinced, meanwhile, is vitamin C, high-dose infusions. Some therapies use up to 75, 100 gram. I know some using 15 gram average vitamin C, B1, B6, glutathione, curcumin infusions, also liposomal forms of glutathione are helpful. Artemisinin is wonderful, and also the biofilms. We have more and more problems with the biofilms for chlamydia. Look, so many patients coming with a sinusitis to me and I say, you don't have Lyme disease, you have a chronic chlamydia infection. It makes the same symptoms. Chlamydia pneumonia it's not the sexual transmitted chlamydia, it's the aerogen transmitted. You got some sinusitis, some slime, and the slime is biofilm, and you have to use the biofilm breakers. Otherwise, you cannot reach the pathogen. You cannot reach chlamydia, mycoplasma, or Borrelia. We know they're intracellular. Every of these viruses and pathogens, they are intracellular. So how to come intracellular with therapies? That's the challenge for the future.
Mm-hmm. And how are people catching these viruses? I mean, is it just passed from person to person, airborne? How are people getting infected?
No, I think that the immune system is controlling it. You got infected when child or young man with or young woman with an Epstein-Barr virus, EBV infection or CMV infection, by a cough, by droplet infection, and then you control this infection. Typically, the herpes simplex virus of the lips. It's immune control, and they survive in the lymph nodes. And then you come into this detoxification, mitochondriopathies. They all have lack of energy with this. They need ATP, for example. So the energies, because the mitochondria are destroyed by it, they are blocked, and they give us the energy. It's not just Lyme disease, it's not just Borrelia burgdorferi. You have a complexity. But I think it's reactivated, to come back to that point. I think it's reactivated in this, but some patients also start with it. They think they have Lyme disease. I say, no, you don't have Lyme disease. You have a herpes simplex virus encephalitis, and that makes you Parkinsonism. So you have to do the differential diagnosis and anamnesis, history, and you need 1 hour minimum for each patient to ask all the questions. But the medical doctors in all systems in the world, they don't have the time for it. That makes it problematic. So I'm convinced we need specialized doctors for it and to give them the time to do a good anamnesis for the patients.
To give people hope out there, and hope is really important when you're ill. For example, if somebody believes they've got Parkinson's disease and they fill in your forms and have the blood test, if there is something there that can be fixed, to be put right, I'm assuming they might have to pay to see a doctor. I mean, before somebody lays out a lot of money, are the chances good to get a positive result?
Yeah. The pre-selection of this group, nobody is sending me blood without any symptoms because it costs money. That would be nonsense to pay money for nothing. Mm-hmm. So the pre-selection of this patient is very high. And believe me, over 99% of the patients I know and laboratory testings, they all have chlamydia infections, EBV infections, same time, Borrelia infections, the same time. So have multiple infections, but it's a little different from patient to patient. What I have found, for example, in the multi-chemical sensitive patients, I find a lot of cytomegaloviruses by the ELISpot, CMV ELISpot. That's for me, I cannot explain that actually, but I know there's a correlation with CMV, cytomegalovirus, and the multi-chemical sensitivity patients. I know that for sure. I got that information from Spanish patients where I see a lot of laboratory results. So we have to find a complexity, but believe me, each patient is different from the other. You cannot generalize now, but in all patients I find something, but we have also some patients, they are completely negative, but just a little number of that.
Mm-hmm. And what do you think people will get out of the conference, Armin, because you're one of the speakers there?
Yes, I have just a little time, but I did also some longer interview for 1 hour, so you can get also some information from my side. I think for me it's also very interesting to come now into this field of LDN. It's my third conference. And also I want to tell you that my laboratory is internationally accredited, and that's so important for the acceptance in Canada of the results, in Australia the results, partly in USA for the results. Accreditation means it's industrial standard we are producing in laboratory. It costs me a lot of money to reach that, and we are absolutely controlled, external controls, internal controls. So, but nevertheless, it's laboratory testing. It's not doing the diagnosis. The diagnosis has to be done in front of the patient, clinically, by the symptoms. And this is where we have to educate the doctors worldwide at universities, workshops. We have to educate them. But so long we ignore that field of chronic Lyme exists or doesn't exist, struggle, inhibits our science, inhibits completely to bring doctors in the knowledge forward. And this is my next aim also on a political level. A lot of doctors are now engaged in with politicians to discuss with them, but nevertheless we have the lobbyistic structures.
Well, thank you very much for having joined us today, Armin, and I look really forward to seeing you again in September.
Yes, I'm so happy to come again. It's, I think, my fourth conference, and I can highly recommend your conference. You're fantastic speakers, so I'm so happy to be a speaker at your conference, and I hope to see many of the listening people now at the conference in Portland.
The LDN Conference is available to everyone, regardless where you live in the world. Fast internet is required. We have an amazing lineup of LDN experts giving presentations and answering your questions. This is a unique conference not to be missed. You can join us either via the live stream at a time to suit you or in person. The presentations will be available online for 12 months. Allowing you to watch as many times as you like at times to suit you. Check out www.ldn2017.com. Any questions, please email me ldn2017.linda@gmail.com. Have you ever been unsatisfied with your patient's test results for Lyme or other tick-borne infections? Armin Labs can provide you with the latest and most sensitive test methods for bacterial and viral infections. Their worldwide services are available to therapists and patients. For more information, visit them online at arminlabs.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.